Now that you know about electromagnetic waves, let's talk about the application of these waves in the radio frequency of the electromagnetic spectrum to the tissues of the body. This form of therapeutic application is called diathermy. Diathermy presents with a frequency of 27.12 megahertz, or 27.12 million cycles per second, and is commonly called shortwave diathermy, abbreviated SWD. Though physiological responses to shortwave diathermy include non-thermal effects, in physical therapy, shortwave diathermy is mainly used for its thermal effects at depths of 2 to 5 centimeters, from mild to vigorous heating. Heating occurs as tissue ions are exposed to the electromagnetic field. Their movement is accelerated in one then another direction. Ions then collide with molecules, thereby increasing kinetic energy and subsequent generation of heat. More significant heating of blood and muscle occurs with diathermy. Primarily, this is because of the high water content. Polar water molecules, when exposed to electromagnetic fields, spin and collide with other molecules, increasing kinetic energy. There are two primary methods for the delivery of shortwave diathermy to the tissues. The capacitive method uses an applicator system that requires making the patient part of the electromagnetic circle. In this method, electrodes are placed on each side of the target area. A disadvantage of this method is that subcutaneous fatty tissue may be heated considerably more than muscle. The inductive method involves the use of an applicator in which oscillating magnetic fields are created in the tissues, which in turn induces electrical currents within the tissues, with the greatest currents produced in the tissues with low electrical impedance, such as skeletal muscle and blood. So in diathermy, dosage is the amount of energy delivered to the body that is absorbed and converted into heat. Since this value is not easily measured, dosage is determined by the desired therapeutic effect and the patient's subjective response. In addition to the general precautions and contraindications to heat, any metal on the patient or in the immediate treatment area should be removed. Metal's high conductivity may increase burn risk. Necklaces, snaps, zippers, and other metal appliances should be removed from the patient. The presence of metal implants and implanted electronic devices are also contraindications. Diathermy should not be used on pregnant patients, and pregnant healthcare workers should remain out of the immediate treatment area.